I Understand.
The medical name for not being able to control urination is enuresis, or involuntary urination. If involuntary urination occurs at night, it's called nocturnal enuresis. And if it happens during the day, we'd call it diurnal enuresis. There are two kinds of enuresis, primary and secondary. With the primary nocturnal enuresis, the person has wet the bed since he or she was a baby and never learned to control the bladder. The secondary enuresis is a condition that develops after the person has learned to control his or her bladder, and then a relapse happens. In a person with normal bladder control, nerves in the bladder wall send a message to the brain when the bladder is full. The brain then sends a message back to the bladder to keep it from automatically emptying until the person is ready to go to the bathroom. But people with nocturnal enuresis have a problem that causes them to urinate involuntarily at night. So what causes enuresis? There could be hormonal problems. Some people's bodies don't make enough ADH, which is a hormone that stops us from urinating too much. So they end up making too much urine and sometimes end up urinating during their sleep. There could be bladder problems, maybe too many muscle spasms, or having small bladders that cannot hold large volumes of urine. There could be also a genetic role in it. Teens with enuresis often have a parent who had the same problem at about the same age. Sleep problems also play a role. Some teens may sleep so deeply that they don't wake up when they need to urinate. Some medical conditions like diabetes, constipation, and urinary tract infections, spinal cord trauma after a fall or sports injury or auto accident or a surgery may also play a role in having enuresis. But in many cases, the psychological problems may play a role. So stress can be associated with enuresis, like with abusive parents, cases of divorce, a death in the family, moving house, a new school, all can lead to feeling overwhelmed, and this may affect your bladder functions. We don't know exactly why, but boys are twice more prone to have enuresis than girls. It is frequently seen in conditions associated with ADHD. So how is enuresis diagnosed? After a physical examination, the doctor will ask you about any concerns you might be having, your past health, your family's health, any medications you're taking, any allergies you may be having, or some other issues. The initial exam will probably include a urine analysis and urine culture. In these tests, urine is examined for signs of disease or infection. So how is it treated then? Treating bedwetting or enuresis depends on what's causing it. If an illness is responsible, it will be treated with medications and then the bedwetting will go away. If there's no specific medical condition, some behavioral approaches and cognitive behavioral therapy will be used for treatment, and they probably will be successful. You can reduce the chances that you'll wet your bed by going to the toilet just before bedtime. It may help to avoid eating certain foods in the evening, especially foods that can irritate the bladder, like coffee, tea, chocolate, and sodas. Any carbonated beverages or beverages containing caffeine will irritate the bladder, so avoid them before going to bed. Imagine yourself being dry, using a technique called positive imagery, where you think about waking up dry before you go to sleep, will help some people stop bedwetting. Some people find that rewarding themselves for waking up dry also works, so try that. You can also use bedwetting alarms With these alarms, a bell or buzzer goes off when a person begins to wet the bed. Then you can quickly turn the alarm off, go to the toilet, and then go back to sleep. It can take many weeks for the body to unlearn the bedwetting process, to learn the combination between the alarm and waking up and going to bed. So be patient. People who sleep very deeply may need to rely on parents or other family members to wake them up if they don't hear the alarm. Sometimes doctors treat enuresis with medications, but the problem usually returns when the medication is stopped. Doctors sometimes prescribe man-made form of antidiuretic hormone to decrease the urine buildup during the night. Other medications to relax the bladder are used sometimes, allowing it to hold more urine. But the good news is that it's likely that bedwetting will go away on its own. In fact, 15 out of 100 children or teenagers who wet the bed will stop every year without any treatment at all. I wish you the best of health. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.